Module 73 deals with biomedical therapies when it comes to treating maladaptive emotions and behavior. An important note regarding medications for the treatment of psychological conditions. The medications themselves do not necessarily resolve all of the underlying problems. The medications aid with the symptoms, but treatment is most effective when the medication is used in conjunction with therapy. So, for example, if a person has poor coping skills or cognitively they misinterpret situations or their locus of control or explanatory styles contribute to their mental health issues, those kind of cognitive issues need to be addressed as well, and medication won't address those cognitive issues. Likewise, anxiety disorders, for example, would need possibly would need behavioral treatment as well in conjunction with the medical treatment. So just keep that in mind, that medication itself is not an answer to all of the questions of a mental health disorder. So when it comes to medication therapies, we have four broad categories. The first of those is antipsychotic medications, and these medications are called antagonists. That may be a familiar term from language arts. These medications are antagonists. They're similar to a neurotransmitter, and it acts against and blocks a neurotransmitter from functioning. So if you remember back to our discussion of schizophrenia, it seems like schizophrenia is associated with an overactive dopamine system, dopamine being a neurotransmitter. So the medications for that affect the dopamine. It occupies the synapse site and it reduces dopamine's activity. So they're antagonists. They act against and block a neurotransmitter. There are side effects. There can be side effects to antipsychotic drugs, including tremors and sluggishness. There is also a long-term side effect called tardive dyskinesia, and that's involuntary movements of the face, tongue, head, even the limbs. It's all like a tic or a repetitive movement that's involuntary. So that is a possible long-term effect of antipsychotic medications. The long-term prognosis for patients improves with the addition of life skill training and family support. So like I said, the medication itself may not be the answer, but if there's supportive therapy as well, that may help complete the picture a little bit more. So antipsychotic medications are the first class of medications. The second, anti-anxiety medications. If you recall, there's a correlation between an overactive sympathetic nervous system and the presence of anxiety disorders. So the sympathetic nervous system is too active and everything seems to be fight or flight. So the medications there help to slow down that central nervous system activity. Again, when used with therapy, it is effective to increase the extinction of learned fears. So once again, behavioral therapy in conjunction with the medication to address the anxiety needs. So we can reduce that fight or flight kind of response with medication, but then to address the behaviors, we need to use behavioral therapy. The third class of medications are antidepressant medications, and these are the opposite. They are not antagonists. These are called agonists. They increase the availability of certain transmitters. So these neurotransmitters then elevate a person's arousal and mood levels. So just remember that difference. Antagonists block neurotransmitter function. Agonists enhance or increase the availability of certain neurotransmitters. Excuse me. There is a positive correlation between severity of symptoms and the effectiveness of these medications. So less severe symptoms don't seem to be as responsive to medications as more severe symptoms. So as severity of these depressing symptoms go up, the effectiveness of medication also goes up. That's a positive relationship. So medication may be less effective, for those with mild or moderate symptoms. The fourth broad category is mood stabilizing medications, and this is for treatment for the swings of bipolar disorder. What they seem to do is they prevent or ease those manic episodes and then lifts depression to a lesser extent. So they seem to work as a person cycles through from a manic phase to a depressed phase. It lessens the peak of that manic phase. So then the resulting depressed phase is not as strong. So those are the four major categories. We do have other forms of biomedical treatments that are not medication related. The first one of these is brain stimulation using electroconvulsive therapy. It's commonly called shock therapy, where a patient receives a general anesthetic and a muscle relaxant, and then an electrical shock is applied strategically for the person's brain. How it works, not quite sure. Perhaps it induces seizures or other side effects that calm the brain areas that are overactive, and then those overactive areas are producing the depression. So electroconvulsive therapy or shock therapy can be used in cases where people are suffering from depression. There's also alternative neurostimulation. One of them is magnetic stimulation, where pulses are sent through a magnetic coil that's placed close to the person's head, and it's done while the patient is awake. There's no memory loss, there's no seizures like there is with electroconvulsive therapy. And again, how is this effective? Or how does it work? It's somewhat unclear. Possibly it stimulates the left frontal lobe, which is less active during depression. We mentioned that earlier when we talked about mood disorders. Frontal lobes tend to be less active for people who are suffering from depression, so it may stimulate that frontal lobe so that it functions more normally. The next intervention is one that is very invasive, psychosurgery. And this is surgery that either removes or damages brain tissue. Obviously, this is the most drastic approach, and it's the least used intervention. It is the intervention of last resort, because if you resort to removing or deliberately destroying brain tissue, there is no going back. Once that tissue is removed or destroyed, its functioning will not come back. So the more famous technique for this was lobotomies in the 30s, where they actually cut the connections between the frontal lobe and the emotional centers of the brain, and it did work, for clients who were uncontrollably emotional or violent. It did work, but it took them to the exact opposite. They had a very flat affect. They became uncreative. They became lethargic. They immature behavior. it was drastic, and it just took the person from one extreme to the other. So lobotomies, uh, not the procedure of choice, shall we say, nowadays. However, some surgeries are done today, again, only as a last resort. For example, to deactivate certain nerve clusters to help with uncontrollable seizures. But what we have now that they did not have then is high resolution MRIs. So those magnetic resonant imaging machines can provide much more pinpointed, precise pictures um, so that those nerve clusters can be deactivated and not have the drastic side effects that we've seen with other procedures. So that's all there is for Module 73. So be familiar with the four categories of medication: the antipsychotic, anti-anxiety, antidepressant, and mood stabilizing. Be familiar with the terms of antagonist and agonist when it comes to medications and their effect on neurotransmitters. And be familiar with the alternate methods of biomedical intervention, the electroconvulsive therapy, the magnetic stimulation, and the psychosurgery. So be familiar with all of those.